in the last session, we have covered about the nomenclature, about what clubfoot is, what are the different types of clubfoot. So now we will be trying to cover the pathoanatomy, understanding what is actually going wrong with these feet, and a little bit on the radiology, because radiology is not really very important as such for clubfoot. Yes. So coming to the pathoanatomy, so this is for your exam point of view. So when you're writing an exam, you need to write things structurally, but also for your understanding. So now when we talk about the pathoanatomy, we are going to talk about all the structures which are at fault. So we will start off with the bones. So in the bones, we know that most of the bones are all the bones of the hind foot and the midfoot. So you are having all the tarsal bones which are at fault. So the first and foremost is the talus. So this is a bone which is the prime suspect for CTE. Now the talus is smaller in size. The body itself is smaller. The neck is short, and the anterior end is medially and plantarwards deviated. And the anterior and medial facets of the subtalar joints are abnormal. Okay, so this lengthwise, it is small. The neck is shorter. The anterior process, this part, goes medially and downwards. Okay, so this is on the lateral view. It is looking more downwards. So if this is your talus, the anterior process is looking downwards. So if the anterior process looks downwards, everything that articulates with it, that's the naviculus, will look downwards, and the rest of the bones will be in relationship. So if this is the tibia, then the foot goes into sort of a cavus sort of a deformity, because that's your hind foot over here posteriorly, and that's your forefoot. So this particular deformity happens at the midfoot, which is like the cavus deformity. And of course, the anterior and medial facets of the subtalar joints are abnormal. So that's where the talus articulates with the calcaneum. That is the subtalar joint. Now, apart from the talus, we have the calcaneum. In the calcaneum, the problem is in the anterior surface of the calcaneum, where it articulates with the talus. Now, this articulation is medially deviated. Because the talus itself is medially deviated, the anterior and the medial facets of the talocalcaneal joints are also medially deviated. Then you have the naviculus and the cuboid. The navicular and the cuboid, both of them are medially displaced on the talus and the calcaneum. So for comparison, on your right hand side, you are having the CTEV foot, in which the talus is medially tilted, and the talonavicular as well as the calcaneocuboid joints are medially dislocated or subluxated on the talus. So these are the primary problems of the CTEV with respect to bones. Apart from the tarsal and mid-tarsal bones, you are also having a problem with the tibia, because the tibia is supposed to be internally rotated. That is, an internal tibial torsion is seen in children with CTEV. Now, this is the pathoanatomy with respect to the bones. Now, apart from the bones, there are other structures at fault as well, and they are the joints. Now, the joints which are primarily seen are the tibio-talar joint. Now, in the tibio-talar joint, if that's the tibia, this is the lateral view, and the talus. So the talus is going to be plantarwards, and the anterior process is pointing downwards. Okay, so this gives rise to an apparent equinus deformity. So the equinus happens at the tibio-talar joint. Okay, so that's your first joint. Apart from that, you are having the subtalar joint or the interosseous joint, which is also the talocalcaneal joint. Okay, So that's your second joint, which is at fault. The other joints, to be visualized, you need to remove the tibia, fibula, as well as the talus. And then we can see the other joints, which is the talonavicular joint. So the talus articulates itself with the naviculus. That's the naviculus here. This is the calcaneum. And here is the cuboid. Okay, so these are the three bones. Yeah. So these are the three bones which are seen. So you have the talonavicular joint anteromedially. You have the calcaneum cuboid joint laterally. Okay. So these are the four joints which are at fault. So of course, if you have joints, you are also be having things which are crossing the joints, which are the tendons and the ligaments. Now the tendons which are at fault are all on the posteromedial aspect.